नमस्कार। आप सभी का आयुष समृद्धि की 825वीं वेबिनार में हार्दिक स्वागत है। आज वर्ल्ड चॉकलेट डे है। चॉकलेट का वर्णन आयुर्वेद में मैंने तो नहीं देखा, लेकिन आयुर्वेद की अपनी बहुत सारी मिठाइयां हैं। मिठाइयों का पाक है, वैसे कल्पना इससे भरी हुई है। कई तरह के मीठे योग और हमारे यहाँ मोदक के रूप में, पानक के रूप में, शरबत के रूप में कई तरह से हम लोग मीठी चीजों का सेवन पेशेंट्स को कराते। आज वर्ल्ड चॉकलेट डे के दिन सभी को हैप्पी वर्ल्ड चॉकलेट डे। लेकिन हम आयुर्वेद वाले हैं, आयुर्वेदिक मिठाई खिलाने का प्रयास करेंगे, चाहे वर्चुअली सही। बहुत हमें गर्व है कि हमारी छोटी बहन जुपिटरा जी ने अपना नाम दिया, आदरणीय सुधाकर जी ने अपना नाम दिया, तो दोनों ही को मैं नमन करता हूं। आज बड़े दिनों बाद प्रोफेसर ब्रिजेश मिश्रा नागपुर से जुड़े हुए हैं, नमन करता हूं। भाई जुड़ा कीजिए, आपका ही मंच है। आप बहुत दिनों से कहीं नदारत थे, लेकिन जुड़ा कीजिए, ये मंच आपका ही है।
जी जी
जी, मैं निशांत शुक्ला जी को नमस्कार करता हूं, सतप्रिय नायक जी को, और हमारे गार्जियंस विष्णु प्रसाद शर्मा जी और वीके अग्निहोत्री सर, दोनों को सादर नमन है। महावीर जी भी आज जुड़े हैं इंदौर से। महावीर जी नमस्कार, बहुत बहुत नमस्कार। मैं परसों संडे को इंदौर में हूँ, हम लोग मिल सकेंगे तो अच्छा है। मैं परसों इंदौर में प्रेसिडेंट में हूँ। मैं आदरणीय विष्णु प्रसाद शर्मा जी से सादर निवेदन करता हूँ कि वो वेलकम ब्लेसिंग्स के लिए आशीर्वचन। शर्मा।
Thank you. Good evening to everybody. Respected, distinguished guests, eminent speaker, ladies and gentlemen. I, Professor Dr. Vishnu Prasad Sharma, welcome all of you to this evening webinar on healthy Ayurvedic sweets. Most important subject today we have. So in this webinar, we have eminent speaker. I want to welcome Dr. Jupitera Datta, PG Scholar, Department of Kaya Chikitsa, Government Ayurvedic College and Hospital, Guwahati. Jupitera, most welcome to this evening webinar. Next, I want to welcome Professor P. Sudhakar Reddy, Professor and Head, Department of PG Studies in Swasthya JSS Ayurved Medical College from Mysore. Namaskar, sir, and welcome you to this evening webinar. Once again, I welcome all the eminent speakers, distinguished guests, ladies and gentlemen, to this evening important webinar on healthy Ayurvedic switch. और हम वेबिनार ओपन हुआ ये डिक्लेयर करते हूँ। नमस्कार, ओवर टू पवन जी।
थैंक यू सर। अपन लोग तो होस्ट हैं सर, ओपन डिक्लेयर तो गेस्ट करते हैं।
ठीक, कोई बात नहीं।
तो मैं आदरणीय प्रोफेसर वीके अग्निहोत्री जी को सादर आमंत्रित करता हूँ उनके ब्रीफ प्रियम्बल के लिए। उसके बाद आज हमारे साथ वैसे कल्पना के विद्वान LK द्विवेदी सर जुड़े हुए हैं, तो मैं अग्निहोत्री सर के बाद उनसे उद्घाटन की 2 शब्द की आशा करूंगा। आदरणीय अग्निहोत्री।
नमस्कार, थैंक यू प्रोफेसर पवन शर्मा जी, और हमारे आज के सभी गेस्ट अतिथियों का बहुत बहुत स्वागत है। बड़े हर्ष का विषय है और खुशी इस बात की कि प्रोफेसर पवन शर्मा जी जरूर कोई एक नया टॉपिक लेके आते हैं। दिन तो कोई भी हो, उसको आयुर्वेदिक जो मुलम्मा चढ़ाना होता है आवरण के क्रम में, वो बहुत बढ़िया चढ़ता है। अब इन्होंने मीठी मीठी बातें करके चॉकलेट से ज्यादा बढ़िया वाला मजा तो दे ही दिया, ये कह के कि हमारे पास तो वैसे कल्पना है और उसमें हमारे पास बहुत सारे पानक है, मोदक है, बर्फियां है, माजूम है, पता नहीं और क्या क्या इन्होंने जिक्र ही नहीं किया। लेकिन सवाल ये, जहाँ एक तरफ आप हेल्दी आयुर्वेदिक स्वीट्स कह रहे हैं, मैं मनोविनोद के रूप में कहना चाहूंगा, हमारे पास हेल्दी आयुर्वेदिक हलवाई भी होने चाहिए। शब्द जो हम बिना अच्छे हेल्दी आयुर्वेदिक हलवाई के आप आयुर्वेदिक स्वीट्स की कैसे कल्पना करेंगे? और वो हलवाई हमारा MD PhD 20-20 30-30 साल का अनुभवी होता है, और उनके अलावा घर की दादियां और नानियां। हमारे यहाँ आयुर्वेदिक दवाई स्वीट्स का समय के अनुरूप, अवसर के अनुरूप, व्यवस्था के अनुरूप बहुत अच्छा प्रचलन युगों से चला आ रहा, पीढ़ियों से चला आ रहा। नहीं तो हरीरा और पंजीरी, इनको कौन मना करेगा कि प्रसव के बाद हमारा हरीरा तो विश्व व्यापक है। आज तो नेट पर इसकी बनाने की विधियां और इंग्रेडिएंट भी आने लगे हैं, और ऐसी पंजीरी खालता है। विभिन्न प्रकार के हमारे जितने पानक हैं, और उससे ऊपर लड्डू। हमें तो एक जो सोहर रहता वो याद आ रहा है, ने पहले भी कभी कहा था कि सोंठ के लड्डू चरपरे से, सोंठ के लड्डू चरपरे से आधो दे तो मेरी उंगली तो कहते पूरो दयो न जाए, पसेरे इनमें घी पड़ा है, गरी के गोले 9 पड़े हैं, सोंठ के लड्डू चरपरे। हमारे उत्तर प्रदेश में पूर्व में बहुत अच्छे गाने गाए जाते हैं सोहर के रूप में, और हरीरा, पंजीरी, पानक, माजूम और अश्वगंधा जो लोग नहीं खा पाते तो उनको हमारे बता दिया घर में कि साहब अश्वगंधा के आप लड्डू बना लीजिए, अश्वगंधा की बर्फी काट लीजिए, चाहे इच्छा हो मावा डाल लीजिए। तो हमारी औषधियां जो रसायन वाले ग्रुप की हैं, उनको विभिन्न प्रकार के साथियों के साथ में आपने मुंह में पानी लाने का काम तो कर ही दिया, अब हम स्वाद भी दिए दे रहे हैं कि ये सारे मीठे चरपरे होते हैं और बड़े ही वृक्ष व्यंगणीय और मनोनुकूल वातावरण और स्वास्थ्य देने वाले होते हैं। खासतौर से प्रसूता के क्रम में तो हम जरूर ही कहेंगे कि इतनी बड़ी वो उनका पुनर्जन्म होता है। ये कहा गया है कि जो माता पहली बार बनती विशेष रूप से, वो एक बच्चे की माता बनती है और वो स्वयं में माता बनने का गौरव हासिल करती है। तो इन्हीं सब बढ़िया बढ़िया बातों के साथ में आज तो चॉकलेट न सही, चॉकलेट अब दूसरे की उधारी क्यों ले, हम तो अपनी चीज खाएंगे, अपनी चीज की चर्चा करेंगे। तो हमारी जो ज्योति मित्रा जी आ रही हैं, और रेड्डी साहब तो हमारे पूरा माताश्री अध्याय से लेके और पूरा अष्टो आज विशेषताएं तनानी और विभिन्न प्रकार की परिकल्पनाएं जो चर्चा करेंगे। आप सबका बहुत बहुत स्वागत है। इन्हीं शब्दों के साथ में हम पुनः संचालन के लिए प्रोफेसर पवन शर्मा जी को आमंत्रित करते हैं। नमस्कार, धन्यवाद।
बहुत बहुत आभार सर, आपका बहुत बहुत आभार। हमारे यहाँ लड्डू पाना सब कुछ मीठा मीठा है सर, लेकिन कड़वी दवाइयों को मिठास देने का च्यवनप्राश भी एक यही तरीका है। अगले जो पूरा पाक कल्पना है वो कड़वी दवाइयों को मीठा बना के देने की है। तो मैं हमारे साथ वैसे कल्पना के प्रकांड विद्वान आदरणीय लक्ष्मीकांत द्विवेदी जी हैं, उनसे मैं उद्घाटन की आशा प्रार्थना करता हूं। तो मीठी मीठी बातें हैं आदरणीय द्विवेदी।
सभी विद्वत वृंदों को नमस्कार। आज का जो ये टॉपिक है उसके आधार पे मैं इतना ही कह सकता हूँ कि पाक कला और पाक शास्त्र, तो चॉकलेट बनाना भी उसी पाक कला में आता है। और जहाँ तक बात है विषय विशेषज्ञ के रूप में कोई ग्रंथ हो तो ऐसा ग्रंथ बृहत पाकावली है और माधवकृत है, और उसमें एक सामान्य सा सिद्धांत है, कोई भी पाक बनाओ, कोई भी औषधि द्रव्य हो या आहार द्रव्य हो, किंतु उसमें आपके सामर्थ्य के आधार पे पाके द्राक्षादि चार स्यात्, तो ड्राई फ्रूट्स और चारोली द्राक्षा इस तरह की चीजें उसमें जरूर मिलाना है, चाहे फॉर्मुलेशन में नहीं लिखा हो। और यही ब्लेंड डेवलप करने का एक तरीका है। और इसी तरह से एक 18वीं सदी के बाद में एक कॉन्सेप्ट आया रसशास्त्रीय भस्मों को इसमें प्रयोग करना मिठाई के साथ में, और उसका रसायन इफेक्ट लेना। तो वो भी अभ्यास माधव के पाकावली में आपको मिलेगा। हाँ, ये है कि सब त्रिभंग भस्म या नाग वाला लोग बाग लेते हैं काम में, बसंत कुसुमाकर मिला के अड़दिया बना के काम में लेते हैं, किंतु वो एडवाइजेबल नहीं है। सर्दी की खुराक तो ठीक है, किंतु अंत में देर सवेर जाकर के वो नुकसान कर सकता है। किंतु अभ्रक भस्म है, मकर ध्वज है, इस तरह के आइटम, स्वर्ण भस्म है, इस तरह का सामर्थ्य के अनुसार लिया जा सकता है। एक ट्रेडिशन 18वीं सदी के बाद चला कि साहब उसको स्वरूप अच्छा बनाने के लिए उस पर चमकदार स्वर्ण या चांदी के वरक लगाने वाली स्थिति बीच में थी। आजकल थोड़ा सा अपद्रव्य मिलावट के रूप में इस तरह के जो हैं वो वर्जित कर दिए गए, ये मान करके चलेंगे। और इसी के साथ में इस सभा को उद्घाटन के लिए स्वागत करता हूं। धन्यवाद।
बहुत बहुत आभार सर, आपका बहुत बहुत आभार। नाउ आई वुड लाइक टू इनवाइट Dr. Jupiter Datta. Welcome, Dr. Jupiter. Welcome. Now stage is yours. Please, yes, welcome.
Sir, am I audible?
Yes, clear, visible and audible.
Yes, sir. Sir, a very pleasant warm good evening to all the learners.
Slight louder. Slight louder.
Sir, a very pleasant warm good evening. I am Dr. Jupiter, postgraduate scholar, Department of Kaisikicha, Government Ayurvedic College and Hospital, Assam. First of all, thank you very much for this opportunity. And I am much younger to you people, all the learned scholars present here. So the least I can give is just present my views, but I would like कि आप लोग भी अपना अनुभव मेरे साथ दें. So, sir, with due permission, I would like to move forward for the presentation.
Welcome, welcome.
So it's showing, right?
It's
Sir, it's
okay.
showing, right? Yes, sir.
Yes,
Thank
yes.
you, sir. Yes, sir. Sir, I'd like to start that sweets are the symbol of good gesture in India. And so the topic for today's World Chocolate Day is Ayurvedic healthy sweets. Menus put desserts at the end, but Ayurveda wants you to begin your meals on a sweet note. Whether it's regular dal roti sabji or a lavish 8-course feast, the sweets always have to wait till the end. In fact, the word dessert originated from the French word desservir, which means to clean the table. But who's complaining? Habitually, long after you have polished off a sumptuous meal and the brain has sent you satiety signals, there is always room for that baked cheesecake. However, while we have been habituated to satisfying our sweet tooth after a meal, Ayurveda argues that the sweet should come first. Let us look the benefits of Madhura Rasa as per Ayurveda in brief. Madhura Rasa boosts body strength. The human body is accustomed to this state by taste by birth. Madhura Rasa or sweet food are very essential to boost the body energy of children, aged person and diseased ones. It fills the body bulk of emaciated person. It instantly boosts body energy. This property is known as Sharira Satmya. It also boosts strength of 7 body tissues or dhatus. It increases the strength of 7 body tissues or saptadhatu, that is the 7 body tissues, that is rasa, rakta, mamsa, meda, asti, majja and shukra. So it increases longevity and is known as jivana. It also boosts happiness and helps to gain weight. This property is known as pralhadana. It also has functions of Brahmana and Tarpana properties. It also enhances beauty and complexion. It improves breast milk secretion, Madhura Rasa. Foods help to maintain pregnancy and increase breast milk secretion. Hence, in India, it is a ritual to give Ayurvedic milk recipes like garlic milk, turmeric milk, etc., and dry fruit laddus to nursing mothers. It also normalizes movement of dosha, dhatu, and mala. Madhura Rasa promotes normal movement of 3 dosha, dhatus, and mala. This property is known as anulomana. It quenches thirst and boosts body immunity and strength. It is also best aphrodisiac. Madhura Rasa has been praised as Brucia or aphrodisiac. Now, coming on to the main topic of today's evening, let us discuss and see some of the recipes with their health benefits and contraindication of some of the Ayurvedic healthy sweet recipes. This data I have collected from the traditional food recipes from AYUSH System of Medicines portal of Ayushman Bharat. And these are few of the recipes we can prepare according to the Ayurvedic module. First is the Ardhaka Paka, that is ginger burfi. The ingredients are ginger, jaggery, clarified butter, dried ginger powder, cumin, black pepper, naga kesar, cardamom, cinnamon, Indian bay leaf, long pepper, coriander powder, and bidanga. Method of preparation is in a heavy bottom pan, add jaggery, cook till a thick syrup is formed. Then add grated ginger, stir and cook for 5 to 7 minutes on low flame. Add ghee and mix well, cook for another 5 to 10 minutes. Now add the powder of all the above ingredients and cook for another 5 to 10 minutes and spread the content on plate greased with ghee. Sesame seeds may be added to make it bulky and augment health benefits. Let it cool before cutting in pieces in any shape. When cool, store in an airtight container. It remains for about a month. Looking into the health benefits, this preparation helps in improving appetite and digestion, useful in prevention and management of sore throat, cold, and cough. However, we have some precautions also because it is hot in nature. It may be taken in appropriate quantity and never in empty stomach, and is best to avoid in acid peptic disorders. Coming up to the next recipe, that is Madhuka Leha herbal jam. Leha is herbal jam granule known by varied names based on the type of cooking, through steam or by frying in oil or ghee. Here for Madhuka Leha, the ingredients are mahua or Madhuka flowers, dates, raw banana, green gram, sugar candy, bay leaf, cinnamon, pipali, cardamom, honey, ragi, arrow or root powder. The method of preparation is steam cook seedless dates and banana, then grind it into thick paste, saute in ghee, add sugar candy syrup into it and stir well. When it becomes thick, add cardamom powder, etc. into it. Add honey when it becomes cool. It can be dried and powdered with ragi. The health benefits are it is good pediatric food comprised of carbohydrates, easily digestible proteins and minerals, but to be given in small quantities only. The next recipe is lajar ardaka, that is puff paddy ginger granules. The ingredients are lajar, sugar candy, ginger, ghee. The method of preparation is fry the finely chopped ginger in ghee, prepare sugar candy syrup, add powdered puff paddy and ginger to the syrup and stir well. Health benefits are it is a very good appetizer, carminative and digestive, gluten-free food having reasonable amount of protein and iron, so can be given to people having weak digestive power. It may be good alternative for relieving morning sickness in pregnancy and to combat chemotherapy associated nausea if taken in small quantities. However, we have some contraindication also because this recipe is high in refined carbohydrate which can disrupt blood glucose and saturated fat, so is not recommended for diabetics or cardiac patient or in obesity. Another is the gulkan recipe. The ingredient is rose petal or sugar. Method of preparation is collect fresh, preferably desi rose petal, short and wash well, dry thoroughly, make crush or finely chop the petal, mix the petal with sugar in an airtight jar. Keep the jar in sunlight for 2 to 3 weeks. Stir well every day with clean dry spoon. Desired adult dose of gulkan is 2 to 3 tablespoons. It may be blended in milk to make a cooling drink. What are the health benefits of gulkan? If we see, it helps in digestion, improves health of gut flora and intestinal mucus, reduces hyperacidity and thus useful in peptic ulcer and mouth ulcer. Pregnant women and kids can safely consume gulkan to relieve constipation. It helps in controlling various skin issues like pimples, boils, blemishes. The contraindications are since it contains sugar, this with diabetes should be strictly avoided. Another is beetroot halwa, which is a very interesting recipe formed of beetroot, ghee, milk, sugar, cashew nuts, almond, raisin, and cardamom. The method of preparation is pour 2 tablespoons of ghee in a pan. As it melts, add washed, peeled, and grated beetroot to it. Stir and roast on medium flame for 2 to 3 minutes. Then add milk, cook it on low or medium flame until it becomes dense. Now add sugar and cook till liquid content gets evaporated. Add chopped and roasted dry fruits such as cashews and almonds. The health benefits are that it is packed with essential nutrients. Beetroots are a great source of fiber, folate, vitamin B9, manganese, potassium, iron, vitamin C. Beetroots have been associated with numerous health benefits, including improved blood flow, lower blood pressure, and increased exercise performance. Contraindication is diabetes patient. Then we have kharjura laddu. The ingredients are kharjur, cashew, badam, grated dry coconut. Separate seeds from the dates and cut in small pieces, and cashew and almond also in small pieces. We have to slightly roast in a pan with a bit of ghee. Now mix the kharjur pieces in pan and roast for 3 to 5 minutes. Take out all the mixture from the pan and make small sizes laddu and roll it over grated coconut, roasted sesame seeds or khaskhas. All benefits are date laddus are highly nutritious, which contain fiber, antioxidant, and therefore useful for maintenance of good health. Precaution not advisable for diabetics. Now we have Niger seeds laddu. Niger seeds, dates, and jaggery are the ingredient, and the method of preparation is roast the Niger seeds, cool and grind well, cut the dates into small pieces, powder the jaggery, and mix all the products and make it into small laddu. We have numerous health benefits of Niger seeds, as it is rich in macro and micronutrients, minerals, and can play a great role in combating malnutrition. Niger seeds consists of good amount of antioxidant and anti-inflammatory compound. Magnesium, potassium, and zinc are some of the key minerals that are found in Niger seeds, which help to stabilize circadian rhythms and also induce the release of certain neurotransmitters that the body needs for proper rest. Niger seeds are inexpensive source of iron to improve anemia in risk group like adolescent girls and athletes. The contraindication is that Niger seeds may reduce the blood pressure, and therefore anyone on medication for high blood pressure should take precautions accordingly. Using too much of Niger seed may lead to weight gain. Another is apupam, that is the rice pancake. The ingredient is palm jaggery, rice flour, black pepper, cardamom, Indian bay leaf. The method of preparation is roast the rice flour in a flat pan on a low flame. To this roasted rice flour, add powder, black pepper, and cardamom. Mix well. Heat jaggery in a pan with 10 ml of water and prepare thin syrup. Add the flour mixture to it and knead well to make the soft dough. Fill the dough in cones made up of Indian bay leaf or banana leaf and steam for 10 to 15 minutes. Delicious cake is ready, which we also call as apupam. The health benefit is that it is gluten-free and makes an alternative for celiac patients, a rich source of iron and several other nutrients like magnesium, potassium, and calcium. Palm jaggery positively impacts digestive health by activating enzymes and cleansing the system. Palm jaggery helps relieve cold and cough. It is full of complete carbohydrates and is easier to digest. The next is pumpkin and big bean sweet pancake. The ingredients are a ripe pumpkin cut into small pieces, cowpeas, ragi flour, jaggery syrup, scraped coconut, and cake. Soak cowpeas or soybeans for 4 hours. Cook well in pressure cooker, then add pumpkin pieces and cook further with a glass of water. Add ragi flour and boil for a few minutes. Keep stirring, add jaggery syrup, scraped coconut, and ghee. Mix well and make small pancakes. Pumpkin contain antioxidants, so it has definitely health benefits such as alpha carotene, beta carotene, and cryptoxanthin. Pumpkin has high vitamin A, E, C, iron, and folate, which can help boost immune system. It is also one of the best source of lutein and zeaxanthin, two compounds linked to lower risks of age-related macular degeneration and cataract. It is source of soluble dietary fiber and protein, which play significant role in reducing bad cholesterol. However, while I discuss and share my concept on all the healthy Ayurvedic recipes of sweets, we should always be in caution that how too much of everything is bad. So check out before we get indulged to too much of sweet. So let us see some of the bad effects of sugar too. What too much of sugar does to our body. It is said that sugar is the new tobacco as it is highly addictive. Sugar is the new cholesterol because it gets converted into stored fat and increases risks of acidosis. Sugar causes cardiovascular disease, tooth decay, dizziness, allergies, cholesterol, hypertension, colon and pancreatic cancer, type 2 diabetes, ADHD, obesity, hypoglycemia, metabolic syndrome. And now let us see the WHO recommendation for sugar. Free sugar refers to monosaccharides, glucose, fructose, and disaccharides, sucrose or table sugar added to foods and drinks, and sugars naturally present in honey, syrups, fruit juices, and fruit juice concentrates. WHO strongly recommends a reduced intake of free sugar throughout the life course. In both adults and children, WHO recommends reducing the intake of free sugar to less than 10% of total energy intake. Evidence that this level reduces the risks of overweight, obesity, and tooth decay. WHO suggests the further reduction of the intake of free sugar or to below 5% of total energy intake as a conditional recommendation. The WHO guideline does not refer to sugars in fresh fruits and vegetables and sugars naturally present in milk. because there is no reported evidence of adverse effects of consuming these sugars. The sugar guidelines should be used in conjunction with other nutrient guidelines and dietary goals, in particular those related to fats and fatty acids, including saturated fat and trans fat. So I would also like to add that there are certain alternatives of the refined sugar that we use, like raw honey, then dates sugar, then coconut sugar, maple syrup, figs, and jaggery. I would like to add that raw honey, which consists of flavonoids, which means it is packed with antioxidant and has several microbial or antiviral or antibacterial properties. The date sugar is also an antioxidant and fiber advantage. Now, coconut sugar consists of inulin fiber, which is good for gut health. Maple syrup has relatively low glycemic index as compared to refined sugar. Figs that is good for our bone health, blood health, and digestive health. And jaggery is a powerhouse of vitamins, minerals, iron, antioxidant, and it increases hemoglobin tremendously. So with this, I'd like to conclude saying that from cakes to mithai, sugar is mostly used in every sweet dish. While we enjoy the sweetness of white sugar, we often forget the side effects associated with it. If we go by the studies, white sugar is a highly processed item and is associated with obesity, excess belly fat, diabetes, and heart disease. From causing cancer to reducing tissue elasticity, crystal cubes are the source of many health issues that one can easily avoid by saying no to white sugar. It can also cause depression, dementia, liver disease, and certain type of cancer. Hence, it is suggested to avoid excessive intake of white sugar. With this, I'd like to thank everyone who have given me this opportunity, and I pay my utmost respect to the learned scholars present here today, Professor P. Sudhakar Reddy sir, Professor Pavan Kumar Sharma sir, Professor Vinit Kumar Agnihotri sir, and my guru, Professor Vishnu Prasad Sharma sir, who gave me this wonderful opportunity to be present among all the learned scholars today. If I have done unknowingly some mistake, please guide me with the truth, the modified version of my facts. Thank you, everyone.
Well done, Dr. Jupiter, well done. Excellent. Right from the pros and cons, everything you have explained. Well done. Shabash, beta. Shabash. Wish you all
Thank
the
you
best.
so much. Sir. Thank you. So
Wish
much.
you all the best. I welcome Vaidya Ashutosh Patankar sir from Mumbai. I welcome Dr. Sudhakar Reddy ji, and I welcome Professor Ish Sharma from Mauritius. Agnihotri sir. Sorry, Vishnu Prasad Sharma ji, your comment, sir.
Thank you. Thank you, Dr. Jupiter Doctor, for your excellent presentation. You have nicely described regarding Ayurveda switch, along with its benefit. You have
Thank
shown.
you so much, sir. Thank you for the opportunity. Really blessed to be a student.
Okay, thank you. We have shown so many sweets, including leho, laddus, and by taking this laddus and leho, what type of benefit we'll get, you have nicely explained. So once again, thank you very much. Thank you, over to Pavanji.
Thank you, sir. Thank you. Agnihotri sir.
Thank you, sir. Thank you, Professor Pavan Sharma ji. As Professor Vishnu Prasad Sharma is just extending thanks in favor of Jyotipitra Datta ji, I just recapitulated the Assam day, and on that very day you have shown lot of dishes of many types of sweets on that day. So it is in the same continuation, and any sweet which is favorable to the health is Ayurvedic sweet. This is my understanding. This is
Yes, you are correct. Yes, sir, you are correct.
Because you people are using and consuming it for decades and for generations together. Moreover, Jupiter ji also talked about some very important words which I have never seen, that sugar is like tobacco, sugar is like all that damn thing which can lead ultimately to the not only dementia, to GI disturbance and to cancer. So these are the awakening points which she very confidently used, though in favor of sugars, but it's sweets limited consumption. As long it is beneficial to the health, as long it is really required after the delivery and every such occasions when a patient is debilitated and in dire need of so many rejuvenators, well, it is very important. But white sugar as long it can be avoided, it should be. It is better to use brown sugar or jaggery or that derivatives. So it will be much more safe. Thank you so much, and many thanks to Jupitra Datta ji. Thank you.
मैं तो ये जानता हूँ सर, मैं भी मीठे का बड़ा शौकीन हूँ, और मेरे गुरुवर हरिशंकर शर्मा जी 95 की एज में भी 100-150 ग्राम रबड़ी आराम से प्यार से खाते हैं।
जरूर है, जरूर है।
150 ग्राम रबड़ी,
जरूरी है।
नमस्कार।
ये तो उनके सेहत का राज हो गया।
सेहत का राज वही है सर, जो गुरुजी करते हैं।
ठीक बोले आप, बिल्कुल ठीक।
और आयुर्वेद में कुकरी जो है उसका बहुत बड़ा हिस्सा जो है वो वाजीकरण की चिकित्सा में, वाजीकरण के अध्यायों में आया है। ढेर सारी कुकरी दी हुई है, और बिस्किट्स है, केक्स है, तरह तरह की खीर है, मिल्क शेक्स है, आइसक्रीम्स है, सारी चीजें दी हुई है। थोड़ा सा उसको अगर बाहर निकाल करके पब्लिक में पब्लिसिटाइज करके अवेलेबिलिटी बढ़ाने की बातें हो जाए तो बहुत सारी चीजें बन सकती है। ये होटल इंडस्ट्री काफी अच्छे से चल सकती है वाजीकरण अध्याय में।
हमने भी इमामी में चंडू इसके च्यवनप्राश के फ्रूट बार बनाए थे, च्यवनप्राश की कैंडी बनाई थी। वो लॉन्च बाद में थोड़े एरिया में लॉन्च हुई, लेकिन ये बनाई थी, अच्छी लगती थी लोगों को, बहुत अच्छा लगा सर। आप जुड़ते हैं तो बड़ा अच्छा प्रेरणा आती है, आप जुड़ते रहिए। अभी अगली वेबिनार भाजपा की है।
शर्मा जी कल आने वाले क्या? शर्मा जी कल आने वाले क्या? शर्मा जी कल आने वाले? आज ही है। चलिए, मैं लगा रहता हूँ, साथ में पेशेंट भी देखता हूँ और आपसे बातियाता भी रहता हूँ।
जरूर जरूर, थैंक यू सर, थैंक यू।
यस,
मैं आदरणीय डॉक्टर सुधाकर रेड्डी जी को सादर आमंत्रित करता हूँ। आई वुड लाइक टू इनवाइट डॉक्टर सुधाकर रेड्डी जी फ्रॉम मैसूर। वेलकम सर, वेलकम।
Namaskar sir, thank you.
नमस्कार नमस्कार, स्वागतम।
To all the stalwarts of Ayurveda, especially Sharma sir ji and AYUSH Patankar sir ji. The first time I am seeing sir on screen, and VK Agnihotre sir and other persons. And also I would like to say thanks to our Dr. Datta, the first speaker. And nicely, but last few slides I could able to see because I was in clinic, and I don't know why this topic will be overlapping to her. I don't know, because I have not heard about her. And today's topic.
Don't worry, that will also be sweet overlapping.
Yes sir, it will be sweetie. And sir, there's also congratulations for you sir, because you are selected topic. Wherever you go, any function, sweets will be there first of all. That sweets must be Ayurvedic way we want it, not by other people, only Ayurvedic way. That sweets are very important. And if you see the rasas krama also, madhuramra lavana, first madhura only will take, and panchamahabhuta first again that prithvi mahabhuta only. That way the importance is given to madhurahara only. As madam told that that sugar which you are using in the madhura sweets and etc. is also like a tobacco. But I also can say that as Nasupati people, they will believe only other things. Sugar, it's a white poison. This is white poison, sugar. So that shows that the consumption of sugar directly, the refined sugar can be reduced in the preparation of the sweets, whereas Gouda or jaggery can be used. That's only we can use. And with this, I would like to share my presentation, sir. Is it visible, sir? Sharma, sir? Sir, is it visible, my screen?
Yes,
Hello?
yes, clearly.
Yes, sir. Thank you, sir. And now, before going, just I would like to say Charakasamitavan Sloka, living 100 years with wholesome food. It may be Madhurahara, it may be Vedahara, but first of all, wherever you go, sweets will be compulsory. That's why any food, if you're taking wholesome food, Shet Trimchat Sahasrani Ratrinam Hita Bhojanaha Jivat Anaturo Jantu Jitatma Samataha Satam. The person who takes Hita Bhojana that is congenial to health. They live Shatrimsa Sahasrani. So living 100 years. The Shatrimsa Sahasrani equal to 100 years. So Charaka says that if you want to live 100 years, your food should be proper. And how the food should be there? Again, they says that Vishishta Mishta Samskaraihi Patherishtahi Rasaribihi Manognam Shuchi Na Atyushnam Pratyagram Ashanam Hitam. It should be specially made, specially processed, good for health, endowed with good taste, smell, touch, etc. The good taste, smell will come only with Madhurahara as sweets. And pleasing to mind, and more than other Kadita Kasharasas, and Madhura always give pleasing to mind. And it will be clean, not very hot, and freshly prepared. This is called healthy food preparation, whatever may be preparation. So it also apply to the sweets. Now let us see the Ayurvedic classical preparations like Bhaksha, or snacks. That's called Gritapura Bhaksha. Tesham Pranakara Rudya Gritapuraha Kafavaha Vatapittahara Vrishya Guravo Rattamamsalaha. Wheat dough with milk and coconut gratings plus sugar and make into small thin disc and fried in ghee. This will become Gritapura Bhaksha, explained by Bhava Prakasha. It is a Hridya, Vatapittahara and Kafahara. Vrishya, Guru, helps in growth of Rakta and Mamsa. The Rakta and Mamsa dhatus, which gives more strength, immunity to the body, and also in Vajikarana. As that was telling, Vrishya means definitely Madhurahara only. So Gritapura Bhaksha is important one. And Madhushirshika, there is a description. Madhushirshaka Samyavaha Upa Ete Visheshataha Guravo Brahmanaschaiva Modakastu Sudarjaraha. Even though Sudarjaraha, but it will be good for Balya. Wheat dough made into thin disc, lump of sugar, ghee are kept inside, enveloped all around and cooked in steam. That's called Madhushirshika. It's also available in the market. And now Samyava, another preparation, dough added with milk, that's wheat dough, sugar and kneaded, well made into thin disc and fried in ghee. Then powder of sugar candy, ela, maricha, ardaka are sprinkled over it. This becomes Samyava, a sweet dish. Pupa or apupa. Pupa is a sweet pancake. It's also available in the market. And Mukta Modaka. Method is fine flour of green gram should be mixed with water. Mixture to be poured slowly through the sieve, which is placed over deep pan filled with ghee. So drops like pearls fall into the ghee. After it is fried well, taken out and added into sugar syrup and made into balls. This is called Mukta Modaka, what we can call Moti Chur Ladu. It is described again Bhava Prakasha. It is a Lagu, Grahi, Tidoshagna, Swadhu, Shita, Ruchiprada, Chakchushya, Jwarahrit and Balya. And another one, Polika. That is Polika is nothing but like a chapati structure, but another preparation is called as Purna Polika. In that, if you are filling the sweet, it comes under Purna Polika. That is Polika filled with jaggery and dal cooked with low flame. That is Guru and Balaprada. In South India, it's called as a Holika, Obbatu, and Purna Polika. In North India, also preparations are available. And now Lapsika, it is like a laddu preparation. Wheat flour fried in ghee, added to milk along with sugar till attain solidification. Then add cardamom and pepper. That is called Lapsika preparation, again described by Acharya Bhava Prakasha. And another one, Palalam. So this Palalam is like a laddu and modaka only, but equal amount of tila and guda are pounded together and then mixture is made into balls. So based on this tila and guda is the base. We can add any powder like mudga, masha, chanaka and etc. The name can be changed. So mudga palalam, chanaka palalam, like that way. So where the main ingredients are tila and guda. And they are Malakrit, Vrishya, Vatagna, Kapapittakrit, Brahmanam, Guru Snigdham, Mutradikya, Nivartanam. And other sweet preparations like available in Bhava Prakasha are kheer, krichala, that is nothing but sweet pongal. Chirika, that's called Paramannam. Parama means best. So among the rice preparation, the Chirika, which is nothing but kheer in the payasa, the rice, milk and ghee preparation, which are widely used. It is also discovered by Bhava Prakasha. Paramannam, best anna. Narikela Chirika, coconut kheer. Vesana Modaka, motichur ladu. And Kundalini, that's jalebi, what you can see in the figure. And Rasala, Srikanda. All preparations which are now available in the market are based on the Ayurvedic description by Bhava Prakasha in Kritanavarga. These are the preparations that are available in the Ayurvedic way. And let us see now Prapanaka Sharbat, sweet drinks like Sharkarodaka. We know very well, Jalena, Shitalainaiva, Golita, Shubha Sharkaraha. Ela, Lavanga, Karpura, Manichaista, Samanitaha, Sharkarodana, Tas Prasiddham, Vidushaha, Mukai. So, Sharkarodaka, well known preparation, whenever dehydration is there, the people are using Sharkarodaka. That's the preparation. And another one, Nimbu Kafala Panaka. To 1 part of lemon juice, 6 parts of sugar syrup are mixed together. Required cloves and black pepper added to it. Gunas, Amlarasa, Vatanashaka, Vahini Deepaka and Richam. It's also one more preparation of sweet preparation. Amlika Panakam. Ripened tamarind is pressed in and juice is extracted. Sugar, black pepper, cloves and camphor are added to it. It is a Vatanashaka, Pitta Slishmakaram, Ruchya and Vahini Bodhakam. Amlika Prapanakam. And another one, Amra Prapanakam. Unripe mango is boiled in water, add pasted with the hand and mix with sugar, water, camphor and black pepper. It is Ruchikara, again Balya and Shigra Mindriyam Tarpanam. So whenever you are exhausted, so then mango juice people will take. There's Amra Prapanaka, that unripened mango can be boiled in the water and pasted with the hand of mixed with sugar water. This is called Amra Prapanaka. It will relieve your thirst and gives instant energy. That is called Shigram Indriya Tarpanam. And these are the preparations I would like to say within few minutes, sir, for giving this opportunity. Thank you very much. The take-home message is from East or West. Homemade sweets are best. Ayurvedic inputs are accessible, acceptable, adaptable, and affordable. So everywhere, wherever you go, the preparations are available. The only thing is that we need to convey this Ayurvedic knowledge to the people to make homemade sweets. Thank you very much, sir.
Thank you. Your sweet speech. Really, it is fast ending. We were eager to listen or eat visually too many sweets from you. Excellent, sir. Excellent.
Thank you,
with
sir.
reference of excellent.
Agnihotri ji.
बहुत अच्छा सुधाकर जी, बहुत अच्छा.
Thank you, sir. The last sentence itself is a very important messenger for all the presentation, that East or West, Ayurvedic sweets are best.
Yes, sir.
This is what we can say, that Ayurvedic sweets are best. Thank you. Very scholarly address, and with all the good name. I got the first time this word Kundalini means jalebi. Kundalini.
Really, पूरी 60 साल की उम्र में पहली बार मालूम पड़ा सर.
हम बहुत.
Yes,
That's
sir.
why I listen to Professor Reddy very carefully. I listen to Professor
Yes,
Reddy
sir.
very keenly and very carefully. He takes out so many new words, especially of kitchen and our sweets house. Thank you so much, sir. Thank you.
What is the difference between pupa and apupa?
Yes, sir.
Sir?
Pupa and apupa, you told.
Apupa, the sweet preparation, sir. The sweet pancake with rice and sugar and other things, sir. That is the one preparation and the pan. Apupa is nothing but is a more sweet, and less sweet is pupa. That's one difference, sir. In Kerala, it is available. The sweets also. And the second one, what you told, it's also available in Kerala preparation. And all over India, especially North India, people are rice. And like South India, it is only most of the people non-vegetarian, and South in North India, more of the sweets only. So whenever you go to North India, sweets only, and less consumption in South India. Yes.
In my Bengal also, West Bengal.
Especially in Bengal. Especially in Bengal.
There are so many preparations that the Bhav Prakash mentioned, which are now using, sir. But we don't know exactly the names which were given by Shashkuli. Now we have everything is there. Bhav Prakash, whatever mentioned, 154 preparations available in the market in Ayurveda. Market available, names are changing. So Motichur Laddu, actually it is prepared there only. Kundalini, Jalebi only. The preparation, what is there, and etc. Thank you, sir. Thank you.
ये तो नया नाम सुना आज 60 साल की उम्र। मैं आदरणीय वैद्य आशुतोष पटनकर जी से कुछ महाराष्ट्र की हेल्थी मिठाइयों के बारे में आशीर्वाद चाहता हूँ। आदरणीय पटनकर साहेब।
भगवान, ऐसा है कि रसाला का प्रयोग मैंने चिकित्सा में किया है और चरक के हिसाब में किया है, और जिससे कि टेस्टीज की साइज मैं ऑलमोस्ट 1.2 सेंटीमीटर से बढ़ा पाया था। इन्फेंटाइल टेस्टीज थी, वो लगभग 8 से 9 महीने के अंदर मैं 1.2 सेंटीमीटर से रसाला दे करके टेस्टीज की साइज बढ़वाया था। उसके बाद में उसी में सीतोपलादी चूर्ण का प्रक्षेप मिला करके जब 3 महीने तो इंटरनल वो जर्मिनल इपिथेलियम भी रीजनरेट करा पाया था। ये ताकत है आयुर्वेद के अन्न वर्ग की। क्षीर जो है, क्षीर पाक जो राजा दशरथ को जो क्षीर दी, पायस दिया था, वो भी चरक में आया हुआ है। वो अनेक चीजों से भी बना सकते हैं अपन, जिसको भी मैंने आइसक्रीम बना के भी यूज किया है, खीर के रूप में भी यूज किया है, उसको पका करके या केवल मिल्क के साथ मिक्स करके मिल्क शेक बना के भी पिलाया है, और बहुत अच्छे रिजल्ट उसके मिले हैं मेरे को ये इनफर्टिलिटी की ट्रीटमेंट में। बाकी तो केक तो है, केक तो बहुत उम्दा वस्तु है जिसका कि चरक ने विधान किया है पुर्पलिका के रूप में, और अगर अंडरस का भी उपयोग किया हुआ है चरक ने, और वो अंडरस मतलब आजकल भुर्जी के नाम से जाना जाता है। वो अंडरस घी पे बना के अगर खिलाते हैं तो बहुत अच्छे पकवान बन जाते हैं, और वो बहुत सही ढंग से इस्तेमाल किया जा सकते हैं चिकित्सा में, जिससे कि जल्दी से जल्दी स्वास्थ्य लाभ हो सके। और प्रोटीन्स का सप्लीमेंट के रूप में इनको अगर यूज किया जाए तो एथलीट्स में और इनमें जो कि ये सड़े हुए पाउडर्स खिला के जो उसके साइड इफेक्ट आते हैं, उससे अच्छा है कि ये अगर नेचुरल इंग्रेडिएंट्स वाले प्रोटीन्स दिए जाए तो बहुत सुंदर ढंग से काम करते हैं और बिना साइड इफेक्ट के इनको रन किया जा सकता है।
बहुत अच्छा गुरुदेव, बहुत अच्छा। आप जुड़ते हैं तो हमें प्रेरणा आ जाती है। बहुत अच्छा, धन्यवाद धन्यवाद सर। मैं तो ये जानता हूँ आज की बातों से 2 बातें मेरे मन में आती हैं सर। नंबर 1 तो हलवाइयों की ट्रेनिंग का कोई कार्यक्रम बनाया जाए जिसमें हलवाई आयुर्वेद की दवाइयां बनाए, मिठाइयां बनाए।
बिल्कुल।
और
आपको याद होगा शायद पवन जी, वो चौपाटी पे अपनी धन्वंतरी चौपाटी के पहले वो एक हाजमा आजम बेचने वाला राजस्थानी शरबत वाला बैठता था। हमने उसके साथ बड़ी वार्ता की थी, तो उसने बताया था कि उसके दादाजी वैद्य थे और वो उनकी जो दवाइयां थी वो खारीक में भिगो करके डाल करके वो चूरन और वो मिला करके वो शरबत और खारीक के साथ मिला के खिलाया करता था। उसने हमको बहुत सारी चीजें खिलाई भी थी कि साहब ये इस चीज में प्रयोग होता है, उस चीज में प्रयोग होता है करके। तो ये अनछुई चीज है, थोड़ा सा इसको प्रमोट करके ये पानी पूरी के ठेले में थोड़ा सा आयुर्वेदिक चाट आ जाए तो और मजा आ जाए।
जय हो, जय हो, जय हो। बहुत अच्छा, बहुत अच्छा। अग्निहोत्री सर, अपने साथ आज डॉक्टर लीना कारेकर जी जुड़ी हैं, डॉक्टर सत्यप्रिया जी जुड़े हैं। मैं सभी से, अभी 10 मिनट है हम लोगों पे अगली वेबिनार के, तो मैं चाहूंगा कोई भी यदि कोई नई रेसिपी गाइड करना चाहे तो स्वागत। प्लीज रेज योर हैंड्स। डॉक्टर लीना कारेकर जी, am I audible to you, डॉक्टर लीना जी?
देशी दारू
स्वागत है।
हाँ, मगर ऐसा आज मैं अभी लेट ज्वाइन हो गई थी, इसके लिए सुना नहीं पाई इतना सब।
नहीं, आपकी नजर में कौन सी आयुर्वेदिक हेल्थी मिठाई है, बस इतना सा पूछो।
नहीं, इतने अच्छा भी ये रसाला और ये सब सुना है, उससे अच्छा कोई याद नहीं आ रहा है।
कोई बात नहीं, कोई बात नहीं। कोई भी कुछ ऐड करना चाहे।
आप ये बताइए ना, आपने अपने अभी तक के जीवन में कोई आयुर्वेदिक औषधियों को मिला के कोई होम रेमेडी बनाई है स्वीट के तौर पर, जो बच्चों को भी अच्छी लगी हो, बड़ों को भी अच्छा लगा हो और स्वास्थ्यवर्धक भी हो? ऐसा कुछ बताइए ना, अपना एक्सपीरियंस बताइए, शास्त्रोक्त तो जरूरी नहीं है जी। हाँ, हमारे पास आए हैं।
अर्जुन जी, स्वागत है।
देखिए सर, देखिए आप, जन्माष्टमी में जो व्यवस्था बनती है वो पूर्ण रूप से कृष्ण जन्म जी के उपलक्ष्य में प्रसूवोत्तर कार्यक्रम के संबंध में ही सब बनता है। जितने भी गोंद की कतली है, मखाना है, फरबीजे बीज है, सारी प्रिपरेशन उन्हीं के लिए बनती है। जी सर, स्वागत है।
मल्लिकार्जुन जी हैंड रेज किए हैं सब।
जी सर, प्रोफेसर मल्लिकार्जुन, स्वागत है सर।
Sir, namaste sir.
नमस्ते सर।
Namaste sir. I am here to add few delicious recipes mentioned here in Charaka Samhita. Yes, rightly it is said in Rushyavajikarana chapter, second chapter, Chikitsasthanam. When I was teaching to the students, I could find out it is moreover equivalent to gulab jamun like recipe. If you want, we can go through this recipe. Rushya Mahisha Rasa. Rushya Mahisha Rasa. It is almost looks like gulab jam like recipe. And Vrushya Yoga, Vrushya Dadi, Vrushya Kshiram, Vrushya Payasam, Vrushya Pupalika. It is the explanation when we go through this. Vrushya Pupalika is just like puri, which is the duff is mixed with sugar, and it is sweet puri. Vrushya Kshiram, Vrushya Dadi, Vrushya Gutika is also again a type of modakam type. It's laddu variety. So this is a few recipes what I gone through in Vrushya.
Avoid.
I want to add is in Bhava Prakasham, in one incident, he says about Vrushya recipes for female, Vrushya recipe for male. The ultimate Vrushya recipe for female is Tila and Gudam recipe, Laddu recipe. Just now, Sudhakar Reddy sir have been explained. Tila and Tila Guda mixed recipe for females, and for male, it is recipe mentioned is Masha and sugar mixed recipe, made into laddu by mixing ghee or milk, made into laddu. This is a Vrushya recipe for male. So this is what I could add to this topic today. Thank you. Thank you, sir. Over to you, Pawan Kumar Sharma ji.
Thank you, Mallikarjun ji. Thank you very much. Really, we have great range of mithai in our Ayurvedic texts. Welcome. Thank you very much. Professor AYUSH Sharma ji from Mauritius, welcome. Please unmute yourself. Yes, sir.
Wonderful to listen, sir, and this is really enlightening. And as Kashyap has already told, ahar to be mahabheshaj, so no treatment can complete or can start without proper dietetic instructions to the patients and to the healthy for preservation of their health. Interestingly, we have launched like 2 Ayurveda dietetic modules in Mauritius, and very soon we will be having the enrollments. Maybe by the next month we'll be having the students. One is called Ayurveda Dietetics, which is more of theory, and the other one is Ayurveda Cuisine, which is more of like a cooking workshop. And I recall when visiting many European countries, we were delivering cooking classes where we included preparing like khichdi and takra and halwa, you know, simplest, like very simplistic, delicious and very healthy preparations. So surely this is should be taken to the next level where we all can explore and start preparing these forgotten delicacies at our home. As Vadbhat told about lapsika, we in Rajasthan, Pavanji, we call lapsi. So surely whatever traditional like cuisines we are having in any culture, somehow they have taken origin from Ayurveda, and there is a strong need to revisit. Over to you, Pavan sir. Thank you very much for the opportunity.
Thank you. Thank you very much, Ishji. Thank you very much. I would like to invite Pallavi Sodi ji. Madam Pallavi ji, would you like to add anything? Sweet from Maharashtra, healthy sweet.
Sir,
Welcome.
in Maharashtra, good evening and namaste ji to all the audience. In Maharashtra, there is something called as modak. Modak, which is prepared with jaggery and coconut, fresh coconut, and bound by rice flour. This is a very healthy and delicious savory, which should be, a sweet, which is generally eaten on Sankashti Chaturthi, which went yesterday. So there are so many things to explore. There is Puran Pori, which adds to protein and carbs together, a very with ghee or milk. It adds so much of healthy nutrition to be consumed. I'm not very prepared now. Thank you. Thank you, Bhavanji.
Thank you. Thank you very much, ji. Thank you very much. Please do join every day whenever you have topic of your choice.
I will surely. But in between, I was very busy. I could not. That time was taking away for something else. Thank you. I'll surely join.
Thank you. Thank you, ji. Thank you very much. So now I would like to request respected C.V. Jha sir to conclude the sweet webinar. Respected C.V. Jha sir. आप तक मेरी आवाज जा रही है? आदरणीय डॉक्टर C.V. झा सर. नहीं, अभी ऑडियो नहीं जुड़ा है सर का. If anybody would like to add anything on healthy sweets, we have 3-4 minutes additional. Please opine your valuable comments.
पवन जी.
जी सर, स्वागत है.
ये राज एक्समा में सीतोपलादी खिलाने का तरीका हमने उस हजमा आजम वाले से सीखा था. वो खारिक में भर के आपको यवानी शाडव के शरबत के साथ सीतोपलादी चूर्ण भर के खिलाता था. और वो दरअसल इन तरीकों को जो है, जो कि प्रचलित है, इनको प्रैक्टिस में लाने की जरूरत है. तो मैं वो मॉरिशस वाले डॉक्टर साहब बात कर रहे थे कुकिंग क्लास लेने की. उनसे दरखास्त करूंगा कि क्लास लेने के बजाय एक करो, किसी 10 स्टार होटल का किचन हैक कर दो और वहां पे ये सारी चीजें खिलाना चालू कर दो, दुनिया
Wonderful
खिंचती
idea,
चली
sir.
आएगी।
Great.
हैक कर दो और वहां पे खिलाना चालू कर दो। वहां पे पगले ऐसे आते हैं, कुछ भी खा के जाते हैं, ऊपर से ताली बजा के जाते हैं। आप अच्छी चीजें खिलाओगे तो दुआ भी दे के जाएंगे और नाम भी करके जाएंगे।
बिल्कुल।
थोड़ा सा सर इसको, और कि यवानी शैडो जैसी चीज है, अभी मैं बोल रहा था बच्चों से भी, यवानी शैडो जैसी चीज है जिसमें इमली पड़ती है, तो इमली के पानी में बाकी चीजें डाल करके पका करके अगर सॉस के फॉर्म में बनाया जाए और मार्केट से टमाटर की सॉस को रिप्लेस किया जाए, जरा सोचिए कितनी बड़ी इंडस्ट्री बन सकती।
बहुत सही बोले सर, बहुत सही बोले आप।
जरा थोड़ा सोचिए
करते
कितनी बड़ी
जी सर,
इंडस्ट्री बन सकती।
जी सर।
इसी तरह से आगे भी सोच करके एक एक चीज के ऊपर कंसंट्रेट करके लगे रहेंगे ना, तो इट टेक ओवर द वर्ल्ड।
Rightly said, sir. Thank you very much, sir. Now I would like to request Professor V.K. Agnihotri for his conclusion for first webinar on Ayurvedic healthy sweets. Professor V.K. Agnihotri, sir.
यांचा सर्वांग संदेश कमी झाला,
Thank you, sir. Thank you very much. If anybody is interested to say something, most welcome for 5 to 3 minutes, because we are shifting for the next webinar. So if those who are joined late and interested to make the webinar atmosphere more sweet with the help of the Ayurvedic sweets, they can enumerate the names itself. It will give the full information. Or else Professor Pawan Sharma is busy to just shift for the next webinar's link. So I again thank to all our guest speakers, especially our this Japatra ji and Professor Sri Sagar Reddy ji, our Patankar sir, Aswat Patankar ji. They have given good number. Professor AYUSH Sharma ji and all guest speakers. Our Professor Dwivedi ji, who has inaugurated today's this first webinar. So this is all we are rather expert, and we have got up